simple, is basically just another set of medical care. We are trained as family physicians, but we take a little bit of a different take on addressing healthcare concerns and people's problems. So the one thing I like to explain first is the principles of naturopathic medicine, which sets us apart a little from the traditional allopathic. And I'll just run through the principles of naturopathic medicine. And the first one is first do no harm. And I think that's a principle across the medical industry in general. But first do no harm. The second principle is the healing power of nature. The third is identify and treat the cause. So when someone comes in with a complaint, certainly suppression of symptoms can be a good thing, but we want to identify what things are contributing to the complaint. Treat the whole person. So we always look at the whole person. And that doesn't mean just the whole physical person. It means the mental, emotional side, the spiritual side, environmentally, socially, all of those aspects play a role in one's health. So treat the whole person. Doctor as teacher. So I really take that to heart. I think education is very important. Whether or not someone wants to be educated in it, I will let them know what is going on. I think it's a huge aspect of healing. And then the last one is prevention. So those are the 6 main principles of naturopathic medicine. There are 2 others that I think are very important that I was taught by my professors. And I think, especially with female problems and hormonal issues, because there's so many different avenues of helping women, these 2 are probably some of the most important. And the first one is that of resonance, meaning and this is kind of where the art of medicine comes in. You have the science and you have the art. And naturopaths are really trained on how to use the science in an artistic manner, I suppose. But resonance means knowing when a patient comes in, being able to assess them well enough to know what therapy, what drug, what herb, whatever they need at that moment in time for them. You know, what is going to help them, what is going to push their healing momentum, basically. You know, and knowing that, when to utilize what is very, very important with addressing patient care. So as a naturopath, you know, we have all these tools in our toolbox, and so you have to know when and there's a how do I put this? Kind of let's say 1 is the least invasive technique and 6 is the most invasive. And you have to know when to start. Do we start at 3? Do we start at 4? But that's a huge part of what we do, is trying to figure out what's going to resonate with this patient, when to use what. The last one is choice. And that's huge, because what I find is, or what I do with all the patients, and sometimes they like it, sometimes they don't, but I like to educate people on all the different options. You know, we could start here, we could start there, you know, this is how we could proceed this way, and let them understand and educate them on all the different options, and let them come to a decision, make an informed decision on where they want to start. Of course, I'm going to give them my input, and I think you should do this, or I'm not going to do anything unethical, like you want 2 bottles of Valium, well, here you go. That's because that's what you choose. But to a point, they have to make the choice, because if you don't make the choice, then you're not giving that self-empowerment, that motivation, that desire. People are going to be successful when they choose. You know, and I try my best to get them to make the right choice. But the principle of resonance and choice is very important, especially when it comes to female problems, because there's a lot of different avenues of addressing hormonal imbalances and things like that. And so those 2 are very important. But anyhow, that's just a little bit about naturopathic medicine and what we do when it comes to patient care.
So I guess before we kind of jump into how do you treat hormones, how do you influence hormones, I guess we should kind of start with what is a hormone, you know, because we talk about hormones and we all know we have hormones, but what do hormones actually do in the body, and how do you kind of define what they are?
So basically hormones are just like, they're messengers. It's how the body talks, how each part of the body talks to each other. And hormones are secreted in the blood. They're usually more slow acting. They're not like neurotransmitters that are more quick acting, like adrenaline, which can within half a second have a reaction in the body. So hormones are secreted in the bloodstream. They are secreted within our endocrine system, and our endocrine system is our hormone system, and it starts all the way up in our skull area where the hypothalamus, pituitary, we got the thyroid, the parathyroid, the thymus gland, stomach, pancreas, have endocrine hormones involved there too, and then all the way down to the ovaries and the testes in men. So we got all these different organs. They're all talking to each other. That's why it's so important to look at the whole person, regardless of the imbalance, is because, surprisingly, our whole body is connected. That's a little bit about hormones. Basically, they're just kind of messengers that run your body.
So I guess that I think is, at least for me, what makes hormones so difficult is because they are slow acting in the body. It's not kind of like exactly what influences them. It's kind of more because they change over time. How do you know what actually influence your hormones, and what sort of things kind of have you seen in your practice? What influences female hormones kind of the most?
Everything. The biggest influences, I think, when it comes to imbalances, right? Are you asking? Mm-hmm. The biggest influences are going to be environment, diet, lifestyle, and it's all accumulation over time. It's not like, how do I want to put this?
It's not just any one single thing.
No, it's accumulation of many, many things. It can contribute to how your hormones are being secreted or being detoxified, or how the receptors are reacting on the cell sides, and all these different things can cause different imbalances. Even our thoughts can control hormones over time. I mean, you can change your neurotransmitters, which in turn can change your hormones. So everything plays a role in how our hormones are balanced, and how they're being secreted and regulated. But probably in modern day life, the two contributing factors to imbalances is probably the foundation is probably diet and lifestyle. And that includes environment and some things that are in our control and some things that aren't. Mm-hmm. But it's trying to figure out what those are for that person, because everyone's different.
So for some of the main hormones, like estrogen, progesterone, testosterone, what are some of kind of the main symptoms of an imbalance in some of those hormones that women experience? And I can imagine that would be different maybe for younger women versus, women who are perimenopausal. But what does some of the deficiencies look like, or not deficiencies, but imbalances in some of those hormones look like?
Oh gosh, there's a long list of symptoms, and I think there's a handout that may be in your packet of symptoms that could be related to hormone imbalances. And that's everything from temperature dysregulation, so hot flashes and night sweats, to sore breasts. Menstrual irregularities is a huge one. Amenorrhea, which is lack of menses, longer menstrual cycles, shorter menstrual cycles. I mean, anything out of the ordinary regarding the menses can be related to hormonal imbalances. Then again, it's figuring out, what is the imbalances and why? Let's see, headaches, anxiety, depression. It doesn't mean it is hormonal imbalance, but there usually is some element of the hormones involved when someone is complaining about those complaints. Sore breasts, that's a common one.
I was just telling Dr.
Carbohydrate cravings.
But prior to the lecture, I was just telling her, I actually learned on one of the handouts, it talks about how caffeine has a big influence on how your body processes estrogen. And, during the wintertime when it's cold, I tend to drink more coffee, and I've noticed that my mood has been more off, my cycle's been more off.
Really?
And oh yeah. And it's, you're not in the same dome as me anymore. No, but over 500 milligrams of caffeine per day has an influence. I think it was, look at the sheet for the exact number. I think it was people who drank that amount of coffee had 80% more estrogen in the body. And so, which can start to imbalance, your hormones. And so maybe talk a little bit about that. Talk about estrogen dominance and what that looks like, because, there's a lot of, I don't know if anybody's heard that term before, but, there's a lot of conversation about, having too much estrogen and what causes that and what are the symptoms of that and how does that, lead to other, more formal diagnoses that women have.
Sure. So first off, I will make a comment about, she was talking about caffeine, and a lot of times I'll have patients tell me, well, I've drank a pot of coffee every day and I've never had fibrocystic breast, or I never have a problem. And there are some people out there that can process out caffeine no problem. That's where another element of quote unquote cause would be more of a genomic or genetic contribution to what's going on in your body. A lot of people can't process out caffeine as well. And caffeine is processed out through the same liver pathways as estrogens. And so the more caffeine you take in, it can slow down that pathway, and it can contribute to more estrogen metabolites than you're wanting, which can stimulate breast tissue and cause fibrocystic breast. And that's why they say stop caffeine when you have cystic breast. And typically people who have cystic breast, for instance, have problems with that pathway. I mean, I don't know, 80%, 90% of the patients I see that complain of that typically do. So that's why they say stop caffeine. Well, there are other things that can help too, like magnesium and many dietary interventions. But of course, the first thing you look at is remove the cause, or remove a chemical that may be hindering the system. But so that's about the caffeine and genomics. You asked about estrogen dominance.
Yeah, estrogen dominance.
So what are the main causes of hormonal imbalances? And by no means is this always the cause, because I've definitely seen some people with very low estrogen, well, I'm getting ahead of myself here. Estrogen dominance is probably the most common cause of hormonal imbalances. Estrogen dominance can manifest in different aspects. It can be very, very high estrogen levels in comparison to progesterone. Or it can be normal estrogen and low progesterone. It can be very low estrogen and people aren't even ovulating. Like even on the birth control pill, or someone who has amenorrhea with no periods and have low estrogen, they're still estrogen dominant. When you're not ovulating, you're still estrogen dominant because you never have progesterone secreted. So it doesn't necessarily mean excessive estrogens, but it's in the ratio of progesterone. So anyhow, that's where that estrogen dominant comes in. But estrogen dominance is probably the most common cause of female problems. And so, what was your question? What do you want me to go into?
Just explain what it is and what causes it. How do women get into such an estrogen dominant state? And then what are some of the conditions associated with that women get diagnosed with that really are an estrogen dominant?
Okay, so I can talk for hours on that.
I know you can.
Okay, so some of the causes of estrogen dominance, let's kind of outline them a little bit. Environmental wise, through the diet, for instance, excessive exposures to environmental estrogens, or what we call xenoestrogens, can contribute to estrogen dominance. So those are estrogen-like chemicals that are in our food source, and we find those in, let's say,
beauty products.
Well, beauty products, yeah, lotions and beauty products and stuff like that. Diet-wise, you're going to see it in a lot of hormonal-fed animal products. You're going to see it in, or a lot of the pesticides or estrogen-based pesticides. So buying organic, especially meat and the Dirty Dozen, are probably, if you have an estrogen-dominant picture going on, or even if you want to prevent it, you have a family history, I tell patients, well, buy organic when you can, especially the meat and the dairy products. And the Dirty Dozen vegetables. If not, clean your vegetables very well with vinegar solutions. That's a big contributor. So the environmental estrogens is also in plastics. I mean, think about all the plastics we use. And we can't avoid everything, but we do our best to avoid what we can. And when it comes to plastics, I tell people don't heat or freeze in plastic. Certainly try to avoid foods that are like highly wrapped in plastic, like cling wrap or American cheese, it's nicely all in plastic.
BPA lining cans.
BPA, even if it says BPA free, I mean, some of the other chemicals in cans are still high estrogen. So, but do your best to avoid what you can when you can, as best as possible.
So why do those disrupt estrogen in the body? Why do those chemicals, what is it that they're doing that disrupts your hormones?
So very similar to caffeine is that they bog down some of the detoxification pathways, and you can become nutrient deficient in certain nutrients because of the excess exposure to those. Different amino acids, methionine, magnesium, B6, things like that can eventually get low because of the chronic detoxification of those chemicals. And again, some people can fare better than others as well. And so there is some differences amongst the population of people. That's why one person may have the same exposures as someone else and have different symptoms. But so always remember that. But environmental estrogens is a big role in high estrogen syndromes. Diet and lifestyle in general, overeating, obesity, high insulin, triglycerides, all of that affects a lot of our pituitary hormones and can cause, insulin first of all, insulin is what's secreted when you eat a lot of sugar. And high levels of insulin can promote estrogen production through aromatase. It contributes to high estrogen because it activates some enzymes. So you want to keep your insulin levels down. Your fasting insulin, I like to see below 5. I mean, we check all this on our patients. It also increases testosterone production in the ovaries, so you can start getting cysts and things like that. That's why they talk about insulin sensitivity and prediabetes with ovarian cysts or polycystic ovarian syndrome. So you really want to focus on, not the old pyramid of 11 servings of carbohydrate, especially for a lot of my females who are very petite. I mean, like 5'3" and under, like me. I mean, you don't need that much carbohydrate intake, and a lot of people are excessively eating. And overeating in general, it doesn't matter if it's broccoli or if it's sugar. You overeat, it's going to put a burden on the liver, so you want to watch that.
And this is true for men also. I mean, because if you've ever seen men who are overweight, that's the phenomenon of the man boob, is the more, fat and the more insulin resistant you become, then they same for them. They will start to, become more in this estrogen dominant state, which suppresses their testosterone, and they start to get the hourglass figure of women and lose their sex drive. And so I don't know if we have any, I don't think we have two men in the audience today. Three.
Oh,
three men
Dr.
in the
Ron,
audience. Yeah, there. So, but for husbands, the same sort of phenomenon is true for men also, right?
That is correct. I was about to say something.
I'm sorry.
No, you're fine. You're fine. This is my lapse of memory for that split second. Probably a hormonal imbalance.
With estrogen dominance, what are some of the hormonal diseases that women get diagnosed with that are connected with estrogen dominance?
Certainly, endometriosis is a big one. That's a heavy periods, menorrhagia, where the periods are very heavy and long. That's estrogen dominance. Usually shorter cycles, 21 to 26 days is usually an estrogen dominant picture. Also long ones too, but typically the shorter cycles. Migraine headaches around the cycles are usually an estrogen dominant result. Let's see.
So have you
seen
seen with a lot of your patients
breast
as
cancer.
You start to address that estrogen imbalance, a lot of these conditions can resolve without the use
over time. Yeah, it does take time. And interestingly too, when I see a patient and you do a past medical history on them, typically estrogen dominant females have a history of a lot of allergic symptoms in the past, like eczema, asthma. And typically it kind of like turns into as they get older, but it kind of manifests different in the body. So typically someone will have eczema as a kid, or then it goes into asthma, and then they grow out of that, then they have female problems, migraine headaches, and that's typically what I've seen. That's all clinical observation only. But I find that very interesting, and that goes back to the whole liver and detoxification and problems with phase 2 and methylation and glucuronidation and all.
No, that's a great segue, because how does estrogen dominance connect with the gut? Because gut dysbiosis and yeast overgrowth and all of the irritable bowel and all the autoimmune issues we see with the gut, very often you see hormonal imbalances that go hand in hand with those things. So what's the connection with the gut?
Well, there's several connections that we know about, and there's probably a lot more that we don't know about, probably hundreds that we don't know about. But the first one is the most obvious, and that's just in general constipation. I would say, I don't think a patient that has endometriosis or some sort of heavy period issue has not come in not constipated. And a lot of people are constipated, they don't even know they're constipated because they're not they don't know what normal is. So I always have to teach people what normal is. But constipation can cause the recycling of a lot of the estrogen metabolites, and that can be a problem. Also, the gut flora play a huge role. So you may have read, take probiotics for proper gut health and the flora, and I think that's very, very important. But in certain women, I think they need to be tested too, because a lot of the probiotics aren't repopulating the gut well. And then a lot of the anaerobic bacteria, anaerobic means non-oxygen producing. So if they don't have, if a patient doesn't have a lot of lactobacillus particularly, because that's the one that makes a lot of hydrogen peroxide, they'll secrete what's called beta-glucuronidase. And you can check that on stool samples. And if it's high, it will interfere with phase 2 in the liver and processing out estrogens. And it creates a bad estrogen metabolite, basically. And that can contribute to breast cancers and uterine cancers and things like that. I see that quite a bit on patients that come in with those diagnoses. So if I catch it early, I educate the patient on, you need to do this because of this. And that's where the education is key. Because if people don't know what's going on in detail, they won't be as complacent, not as complacent, as compliant. And they won't do what they need to do to prevent. Because prevention is key.
So one term you've used quite a bit that I kind of want to define for the audience, just in case people haven't heard this term before. But what's the difference between estrogen, estradiol, and then you've used the term estrogen metabolites. So what are estrogen metabolites in comparison to those other two terms, and kind of what's the big difference?
Okay. Well, estrogen, there's many different types of estrogen. There's E1, E2, and E3. E1 and E2 is made in the ovaries, and E2 is estradiol is the most potent estrogen. That's the one that's in charge of the menstrual cycle, and typically that's the one that lowers when women have hot flashes and things like that.
It's the one they measure for most blood tests.
And E3 is actually the one that's made in the liver through the process of detoxifying, as well as some of the metabolites in the liver. So the metabolites, basically, you have to remember, everything your body makes, it has to detoxify out as well. So you use a hormone for a certain amount of time, and the body has to rid of it. And estrogens are rid of in the liver and through the bowels. And so the metabolites are basically the metabolites of estrogen. The liver has phase 1 and phase 2, and that's how it gets rid of all sorts of things. The metabolites get secreted in the bowels. And whether or not, I don't want to go into too much detail because it can be very confusing. But certain ones will, if they get especially if there's constipation, and if you're pushing a bad metabolite and they get recirculated, will have a more strong effect on estrogen tissue and cause more, expression of that tissue. So you want to make sure the liver is processing things out well and they're not recirculating. But I don't know if that answered your question.
Yeah, so you're saying the estrogen gets broken down into these metabolites. Certain ones are okay, certain ones are much more toxic. Those get dumped into the bowels. So that's where constipation comes in. If it's not being eliminated right away, then the body circulates it. And those estrogen metabolites have a more damaging effect, especially in reproductive organs, compared to the original estrogen to begin with.
Correct.
So getting rid of those. So what are some of the supplements that are really helpful for getting those estrogen metabolites kind of cleared through detox, cleared out of the bowels, kind of every step of the way? What are some of the best supplements for that? Or foods?
Yeah,
what are some of the best foods for that too?
Sure. Well, some of probably the first one would be flaxseed. Is one of the best. Ground flaxseed. It's a great binder of estrogen, and it helps with fiber as well. But it will help bind the estrogen. It has the oils in it have an affinity for it, and it can help push it through the bowels. Evening primrose oil can help as well. That's why you hear a lot of women on evening primrose oil. So those two help with moving the bowels as well as binding it. Bran is used a lot too, and bran is used in detoxification in general for people to help bind certain chemicals and heavy metals and things like that. Other supplements to help the liver, and a lot of times you don't need all the supplements. If you just get diet corrected and the bowels functioning, and that's where that's where I go back to that whole. Oops, sorry. He knows I'm doing a lunch and learn. That's why I go back to the whole, when you see a patient and you have, okay, let's start here. Sometimes we can start at stage 1. Sometimes it's start at stage 3 or stage 4, depending on where they are in the disease process. But sometimes, my point is, sometimes you don't need all these supplements. But anyhow, magnesium, B6 is very important, methionine, and inositol. I mean, these are all that really help push phase 2 of the liver in detoxifying. Indole-3 carbinol, DIM, diindolylmethane, that's a common chemical nutrient that we use, not chemical, but it is chemical, nutrient that we use to help with the liver processing out estrogens, and it's found in cruciferous vegetables. That's why you may have heard, try to get 1 to 2 cups of cruciferous vegetables every day if you have an estrogen dominant situation. Typically, I tell patients cook them. You don't want them raw, just lightly, even just lightly blanching them. There's the whole issue of the goitrogen effect, and the thyroid, and I was told that there's not much to that, but in general, you want to lightly cook. And really, you don't really want to eat raw Brussels sprouts, and I guess some people do, but you want to lightly cook the cruciferous vegetables, and that really, really helps. Lots of garlic and onions, the sulfur components in certain people. People need a lot more sulfur to help with estrogen. Sometimes MSM is used a lot, which is organic sulfur compounds. It's a derivative of DMSO. So, it depends on the patient. Not everyone needs all of these things, and that's the key with, that's the advantage and the disadvantage of naturopathic medicine. The advantage is we have so many different tools. The disadvantage is that for a lot of patients, they just want to be told, this is what I need to do, and that's it, and get better. But a lot of times, you have to change things over time to get healing. So
do some of these strategies work for not only young women, but also for women who are perimenopausal? Like, are there different things you would recommend, for a woman, say, who's in her 20s, 30s, or even for people who have, women who have young daughters who are about ready to start their cycle? I mean, what different things would you recommend for somebody like that versus maybe women who are at a later phase in life where, their hormones are starting to slowly decline.
Or they're 40 going through perimenopause already.
Right.
You can typically use a lot of the same techniques. It's all about how you cycle them in a cycling woman versus a postmenopausal. One thing I will say with the difference between premenopausal and postmenopausal women is the use of hormones. Typically in the premenopausal woman, the way I address them anyhow is I try to go without hormones first. Even something as simple as progesterone, typically it now depends on where they are on that spectrum of disease. I try to avoid that and have them do everything else so they can watch their own body heal and watch what they need to do to see the body balance out on its own. It depends on how much time we have and what we're addressing at the time. In the postmenopausal woman, I'll be more apt to use bioidentical hormones more readily than the premenopausal woman. So that's one big difference between those groups. Although even in postmenopausal, some women do great without the hormones as well. So, but the herbs that are used, some herbs I use a lot, like taste tree and vitex. I use lots and lots of that in premenopausal women. Perimenopausal women. Postmenopausal, you wouldn't necessarily need that. So there's certain things you wouldn't necessarily use. Diet and lifestyle, absolutely, almost identical. But some of the herbs and stuff I wouldn't use. Vitex is used. You're asking what that? Is that what you're asking?
Yeah.
Okay. Basically, that's used to manipulate the pituitary gland, so it can help with addressing the LH. It helps with helping ovulation. I use it a lot mostly in amenorrhea, lack of menses. It's amazing. It takes time. You're going to have to, it takes 3 to 4 months to get it regulated, but it works great. Helping with luteal phase defects, it's a great herb to use. One of my favorite, across the board for everything, it's one of my favorite because it works. I've seen it work so many times. And I apparently had a patient tell me that there's a Wichita group that's what did you say it was? The Vitex baby group or something. All these women that got pregnant on Vitex, they were trying to get their cycles regulated, and it helps fertility so much that there's a Vitex support group or something. I was like, really? Okay.
So how, for a woman, you had said some women do great without bioidenticals, some women need it. How would a woman know if she needs bioidenticals or not? And when is the appropriate time to start them?
I always look at how much is their life interrupted. If a woman is not sleeping, if they're sweating so much they're changing their clothes throughout the night, 2 or 3 times a night, if their relationships are being affected, that's when I'm like, okay, let's start with hormones, right? If they're having to start antidepressants and do all these other interventions, Valium and whatever the case may be, I'm like, well, let's start hormones first, because in the grand scheme of things, probably the risk of that is less than the risk of using the medications. So in that situation, that's what I look at mostly. Mm-hmm. And I educate them too. I'm like, we don't have to do this. We can start off this way, and that's where the choice comes in. Mm-hmm. Now let's choose. Mm-hmm. In your case, I'd probably do this, but...
Mm-hmm. So the flip side, I'm going to ask the flip question then. For younger women who have hormonal dysregulation, when is the appropriate time to maybe use something like birth control, which is also an exogenous form of hormones? When is the appropriate time to use that, or do you typically recommend that at all for younger women?
Yeah,
to regulate their cycle.
Mm-hmm. There's been some times. By no means am I. If we are going to do the birth control pill, there's a lot of things I make sure that we look at. One, that they're on methylfolate, because it depletes methylfolate, causes cervical dysplasia in a lot of women. So we want to prevent that. So there are a lot of things, even if I do use that, I'll help them make sure they don't get the side effects as much. There have been a few cases where I'm just like, you know what, we need to do birth control. Either the things that we were doing didn't resonate with them. They, for whatever reason, couldn't adhere to the lifestyle management issues. They were working 3 different jobs. They had legitimate reasons why they're having problems. I'm still educating them on, well, we got to get this there. It is what it is. You have to make these changes. We're going to do this. But for now, let's put you on the pill. Very rare does that happen. Mm-hmm. Very rare, but there's been a few. There's a few times where I'm like, we're not getting anywhere. We're gonna need the birth control pill right now. And sometimes when they're extremely anemic, if they're bleeding excessively, you have to look at all those things, and that's when you may want to use that. A lot of patients and even other providers and think just because I'm an ND, I'm totally against conventional care, and that's not true. Again, it's knowing what to use, when to use it. A lot of times I refer out for those sort of situations. I don't want to take over that. It's not my scope. It's not my specialty. It's better if someone else manages a lot of that. And it's not like I'm saying, I can't help you. But for now, timing-wise, you need this. Mm-hmm. But that's a rare occasion. Yeah.
So you brought something up that I think that was interesting in that you talked about lifestyle, working jobs. So how does stress play into all of this? Because as a woman, we all know how much stress can influence your cycle. And, so what role does stress play in all of this? And then vice versa, what role does imbalanced hormones, how does that also influence stress levels? Because, the symptoms of mood, and they're both connected. And so...
loaded question. Well, stress, I hate the word stress, by the way, because everyone says, I'm just stressed. What does that mean? And I actually, there was one patient I sent to stress, like a stress, no, not stress manager, stress class. He said he wasn't stressed. I'm like, you are stressed. You are stressed. Just because it's not negative, you are stressed, and you're going to have problems if you don't address this. So stress and cortisol, our stress hormones, cortisol, adrenaline, they can affect our whole hypothalamus pituitary axis. Thank you. Axis.
Pregnancy hormones can also affect.
And what is stress? Stress, it's how you interpret it. But stress is just stimulation. Overstimulation on the body is a stressor. So too much, you need some stress. You got to have stress. You can't live without stress. You have to have stress on your bone for bone health. You have to have some. But stress can really cause a lot of hormonal imbalances across the board. Pituitary, thyroid problems, adrenal problems. And a lot of people hear about the adrenal glands and the stress glands. And a lot of times if you're having to oversecrete cortisol because you're stressed, a lot of your progesterone production will go towards cortisol production, and you're start losing your cycles. So that's one reason why women will lose their cycles, but they'll also lose their cycles because of the pituitary problem, and you have to assess, why. But stress can have a huge effect on the hormone system. I mean, I could talk for days and days and days on that. Mm-hmm. But also, I think too, sometimes, so cognitive treatment, cognitive therapy for a lot of patients is important. Relearning, what I find with patients too, just helping them kind of realize that their perception of things may be off, or even just some general education on things, like my article I wrote about PMS or something. I think sometimes with women, if you just teach them what is going on with their hormones and what is expected of them during that time, or what's normal to feel, helps them realize, well, this is normal. It helps with anxiety. When the last half of your cycle, you're not as energetic and you're not as productive. Well, that freaks some women out. I can't keep up. I can't. It does me. It has me before, because I'm not as productive as I would have been the first half of the cycle. But that's where you have to have your expectations. You have to kind of understand what's going on, know what is expected of you, and understand it. And that kind of helps with stress. I find it does, that education piece. But stress is a big problem, and sometimes you just can't get rid of it. Sometimes we can't. There are a lot of things that are stressful in my life I would like to just ignore, and sometimes trying to ignore it makes it worse. But it's how you handle it, how you interpret it, how you look at it, all your other lifestyle factors that you need to realize. Even the littlest things can help your body drop stress hormones. The littlest 20-minute hot bath at night, or 10 minutes of breathing exercises, or whatever the case may be, really plays a role. I have some people say, "Oh, well, that's not going to help me." I'm like, well, don't underestimate it. It does. It helps a lot. Yeah.
Okay. Well, that's great. I've got a few more questions, but I thought maybe right now I'll open it up just to see if there are any questions that might spark, some kind of further conversation. If anybody has any questions, I'll kind of open it up to the audience. Yes. Okay, so the question was, how old is too old for the bioidentical hormones?
Okay, well, there's different schools of thoughts on this. The way I was taught and the way I look at it, if you've been more than 4 to 5 years past menopause, it probably is not the best time to start them. It's probably better to start them sooner rather than later, from what I've been taught and what I know about hormone replacement therapy. But there are different cases, and every case is different in every situation, but that in general. So typically for like a 75-year-old, for instance, unless I had one patient who went through menopause at 70, believe it or not. But typically around that age, I wouldn't start hormones. Unless, I don't know why you would, unless all of a sudden they're having hot flashes and night sweats, which doesn't happen a lot, unless they're trying to do bone health or anti-aging or something like that. But I would say within 5 years of menopause.
That brings up a really good point. We've talked about estrogen dominance, and we've kind of made estrogen out to be the bad guy. But what are some of the good things that estrogen does? Because there are a lot of good things that we need estrogen for, which is, you mentioned anti-aging.
Yeah, well, estrogen plays a big role in our bone health, for one. I think there's more to it than what we know. I think we don't know. We know that it's related, but we're not quite sure all the exact details on how it's related. It's important for our cardiovascular system, for our vasodilation and how blood flows. Estrogen plays a role there. Now, you don't want too much estrogen either, because that can cause blood clotting and all sorts of problems, more so in some women that have clotting disorders. Estrogen plays a big role in our mind and our brain and how we think. Brain fog can be a symptom of low estrogen. It can be a symptom of high estrogen, too. That's the interesting thing. Some of the symptoms, it gets really foggy. That's why a lot of times, I'll tell a patient, let's measure your levels at certain times of your cycle, or let's see where you are. Let's look at a whole picture. A lot of times, even I've had patients who think they're estrogen dominant, and the reality is they're very high progesterone, extremely high progesterone in the second half of the cycle, which can make them feel hot and warm and make them real tired and anxious and things like that. So I've seen that as well. So that's why I don't like to give hormones unless I look at it, because I've had several cases of that. But yeah, estrogen, you need it. I mean, you need it almost in every organ system. And after menopause, your adrenals take over and the estrogen secretion. And if you have adrenal problems or chronic stress your whole life, then you may have a problem, your adrenals may have a problem taking over production. And typically, those are the women that have harder times with menopause symptoms, hot flashes. And typically, people who have had adrenal stress or adrenal insufficiency or chronic stress to the point that their adrenals are worn out, they're the ones that usually have more problems with menopause, more of the hot flashes and night sweats. I can't tell you, I have tons of patients that have no issue. They get through menopause just fine. Not everyone has a problem. But typically, that's an element with why one, because you can run hormone levels on two women and have the same exact hormones. One woman having problems and one woman isn't with menopause. So it has to do with other hormones as well and other things. It's not just hormones, but the hormones can help. And if someone if their life is in turmoil, then sometimes you want to start hormone right away. I mean, you have to look at the whole picture, because there are times when that happens, and a woman can get, pretty quick relief within days of taking hormones. Sometimes.
Any other questions?
Yes. So if you start taking, my problem is you've been taking hormone replacement therapy. How do you know that maybe you don't need it anymore? When do you quit?
So the question was, if you have been taking bioidentical
Sure.
hormones, how do you know when you quit, when you can quit, or if you should quit?
Yeah, that's a good question. And again, there's different schools of thoughts on that, depending on what you're reading and what, the anti-aging group will probably say never quit. I was always taught that after about anywhere from 3 to 5 years on the bioidenticals, you initiate a gradual reduction. You never just want to stop them. I mean, it typically is not the best way. I mean, I had a woman who's OBGYN. She had some doctor prescribing crazy levels of hormones. But anyway, the OBGYN said just stop them, which was good because she needed to lower them. But then she stopped them and she started spotting and having all these problems. And you want to gradually wean down off of them. And I typically would say up at the 3 to 5 year mark, initiate that or think about it. And I typically every 2 to 3 months will gradually lower the dose. And if a patient has a problem, I say, call me. If you have an issue with it, we can always bump you back up. If you don't, we'll drop it again and see if they can come off. Most of the women do just fine, majority, if they do it that way.
What would you recommend if somebody is getting bioidenticals through their conventional doctor, and let's say they have a family history of breast cancer, or history of, other, female diseases, what would you recommend that they get tested just to ensure that they're not, that their estrogen metabolites aren't too high, or I know you mentioned testing the beta-glucuronidase, in a stool sample, but what other tests could people have done to help mitigate risks of that?
Yeah, I mean, for one, a lot of practitioners will say you don't need to check blood hormones when you're on hormones. That's not necessarily the case. You really want to check hormones regularly, probably every 6 months or so, making sure, because someone can be on the same dose for years. I have had patients be on the same dose for 4 years, and all of a sudden they have a spike in estrogen. Their absorption rate changed, or especially after a stressor or something, I always say, you might want to recheck that. Make sure you're absorbing it the same way. So you always want to look at the actual hormone levels in the system. If you have a cardiovascular history or clotting history, I mean, definitely check out inflammatory markers, CRP levels, lipids. Not that I'm like, you have to have low cholesterol, but you certainly don't want high triglycerides and be pre-diabetic and, have excessive high estrogen. I mean, that's not going to fare out well either. But, typical CBCs. I mean, you want to make sure you stay on top of those things. I mean, it's not uncommon for me to have a patient on hormones come in, and it's been 5 years since they've even had a CBC run. Something checking platelets and things like that. So, it depends on the patient and what their other comorbidities are. But I would say hormones and a lot of the cardiovascular markers you'd want to check for the most part. And then,
Question, yeah.
For perimenopausal people who are taking the estrogen bioidentical hormones, is there a particular way they should be taken? And I know some just take them every day all the time, and others I've read where sometimes they say it's still even a good idea to take the break, like as though you were going through a cycle. And I was just curious about what.
So the question is, how does one take bioidenticals? You know, do you do it consistently every day, or do you take a break in the cycle?
right. So after menopause, well, I've seen different, like you said, I have patients come in on hormones that the doctors tell them to take off a week or a weekend or something like that. Typically, that's not the way I was taught. After menopause, take them on a daily basis. But I'm also not giving as high levels as some of those providers are. I wouldn't advise trying to mimic a cycle. I have some 60-year-olds still having cycles because of their bioidentical hormones. I've seen that before because they're cycling them like that. I don't know if that's the best thing to do, but I would say take them daily, pretty regularly.
Yes.
That's how I was taught. Yeah.
Yes, Jackie?
Ma'am, in the front row?
I've kind of got three in mind. If a person has vaginal dryness and kind of pain, even though they're using ointment, and also if the person doesn't have any sex drive or enjoyment at all, never has.
Never ever.
Yeah, so the question was about vaginal dryness and a lack of sex drive, and how does that relate to hormones?
No enjoyment.
And no enjoyment.
Okay, that is a loaded question. Well, the vaginal dryness part, that is controlled hormonally as well as psychologically. So you have to look at both the physical and the psychological wellness of the person, because there are a lot of, especially someone with post-traumatic, or not post-traumatic stress, but some sort of abuse or some sort of they may have a lot of problems with the ability to lubricate and lack of lubrication will drop sex drive too, right? I mean, if you're having pain, you're not going to be very excited to have relations with your spouse or whoever, if that's the case. So you want to look at the hormones and you want to look at the psychological aspect, the history of the patient, and address a lot of that. There could be some issues with, sometimes physical therapy has been helpful for some women because they've had some sort of inflammation or issues with the muscles contracting too much, causes a lot of pain. So that decreases sex drive. So you really want to look at the whole picture. But after menopause, certainly vaginal dryness is a problem for a lot of women, and that will drop sex drive in those women because it's painful, it hurts. I mean, it's not comfortable. Why would you want to do something that hurts, right? So I typically, the Estradiol cream seems to really help E3. It's not very potent like the Estradiol cream is, so that's typically what I use. It does help most of the time with lubrication. Now, if there's still not a sex drive, and if the patient has not had a sex drive their whole life, then that's really getting into complicated. We have to dig a lot deeper into what's going on there. But it could be physical. I mean, testosterone may or may not help. I see testosterone help maybe 20% of the time for libido in a woman. Maybe. So that's my experience. I don't know what the actual sort of research is. But that might be an element too. Could be some other hormonal issues going on. But you'd want to dig pretty deep, and it's complicated. Good question, though.
Question?
This is from the internet. How do you determine hormone levels after a hysterectomy? The person asking is 54 and taking Estradiol and wants to get the.
Okay, so one of the questions from online was how, after hysterectomy, how do you determine hormone levels?
Well, if you're on estradiol, it depends on if you're on the patch or the oral pill, because a lot of people use the patch. If you're using the patch, you'd probably want to do a 24-hour urine sample for estradiol. If you're using the oral or bioidentical, you can do a 24-hour urine, or you can do what we do is typically measure it 4 to 5 hours after you take it to see where your level is, how high it's getting, or if it's getting high enough, or what's going on. So depending on the form of estradiol, on how you actually do the laboratory test. But
any other questions? Yes.
I guess.
So what's the oldest you've seen hot flashes?
Hot flashes begin, or I've seen, honestly, I've seen patients still in their 70s having hot flashes. I've seen that before. Now, that's not normal. I mean, there's definitely something going on there. And it might be hormonal. It could be something else causing hot flashes. But typically the hormonal hot flash, now I've never had one, but it's a different hot flash than like low blood sugar or something like that. It's starting from the inside and radiates outward, which I'm guessing you're well aware of. But I've seen them as late as 70s, people still having them.
That's not normal. What's normal?
I would say within a year you should be out of that. Well, okay, what's common and what's normal, I mean, that's kind of foggy, I guess. But within a few years at least. But see, some women go through perimenopause for such a long time, and I don't think that's normal either. I mean, that should be a couple of years maybe. But I have some women in their 40s going through, 40 years old going through perimenopause, or they'll come in at 48 and I've been perimenopausal since 40. And that's when the hormones start dropping. And usually it's because of other issues, like diet and lifestyle problems, or stress, or,
So that's a great last question. I wanted to ask you, what would be kind of your top 5 diet and lifestyle things for somebody not knowing anything about case history, but for women who want to help either prevent any hormonal issues, or for people who have some dysregulation, what would be kind of your top 5 things that you would recommend?
Only 5?
Doing? Well, you can combine certain things as far as maybe one could be the different foods you'd recommend. I think the flaxseed is great. 2 tablespoons of freshly ground flaxseed is a great.
Yep. Easy.
So I tell people, throw it in your smoothie. I have a Vitamix, and I can literally throw it in with my fruit, and it blends it all up, and you don't even taste it.
I mean, by far the most important is diet. I mean, I've seen people's lives change just by some simple diet. And I say simple. Simple doesn't mean easy. But diet by far, huge.
What diet things specifically?
Well, I'll tell you, most of the women that come in, not all of them, but most of them are definitely eating the standard American diet, and probably worse than the standard American diet when they come in. Very high, or dropping carbohydrate intake. I'm not saying none, and I say carbs. I mean high grains, refined grains, things like that. Dropping the refined grain intake. Now, everyone looks at me like, oh my gosh, I eat bread with every meal, and how am I going to do this? And that's a big part of my job, is to help them see how it's doable. But dropping grain, refined grain intake, increasing vegetables, especially non-starchy ones. I mean, I tell patients, try to get 4 cups a day. They look at me like I have 3 heads. Like, how in the world am I going to do that? And typically, if someone's not eating any, because I see a lot of patients here in Kansas especially, canned corn and canned green beans is the only vegetables they eat. And corn's not a vegetable, it's a grain. But, you got to get the vegetable intake up. And that's for fiber intake as well as just the nutrients, the bioflavonoids. Bioflavonoids play a big role in...
What are those?
They're phytochemicals.
The colors,
the beta-carotene, the lutein, the lycopene. One of the healthiest things for hormones is actually the little white stuff in the oranges that everyone picks off, right? The little rinds, and my daughter's sitting there picking off every little white thing. I'm like, you need to eat that. She's looking at me like, I don't like it. Get over it. Eat it. It's not a big deal. Anyhow, increasing that is huge. Just those 2 things alone. And then also for a lot of women, some of them decreasing the animal fat, animal protein. Typically, I tell patients start with the dairy, because a lot of times they're not necessarily overeating meat and they need the protein. So I just say drop cheese and milk, and it doesn't mean none. But sometimes I look at diet and they think, oh, I don't eat a lot of dairy, and I'm looking at it, I'm like, well, you had 4 servings, 4 or 5 servings. People don't realize what they're taking in. That's why I like for them to write it down, because that helps. But dropping animal fats is very, very important diet-wise. Getting omega-3s in is important. The good fats, the anti-inflammatory fats, which you get in flax seeds and, wild fish and things like that. Grass-fed animals or wild animals. Wild animals, they eat grass. Apparently the wild animals eat grain here in Kansas, according to my farmers. Told me that. I'm like, venison's a great source of omega-3s. Nope, our venison eat corn. I'm like, oh, okay. I learned a lot moving here to Kansas. Let's see, other diet things. Fruit, I tell patients to focus on the vegetables. For females, typically 2 or 3 pieces of fruit is enough. A lot of people just eat tons of fruit because they love it and it's sugar and they don't eat the vegetables. I'm like, nope, you got to get the vegetables in. Find ways. If people say I don't like it, I look at them and I'm like, we're going to find a way to like it. You're going to have to, and we will. You just hang in there.
I actually, not to interrupt you, but I've actually found with a number of patients, specifically hormone sort of patients, that when they cut a lot of the processed flour and stuff like that out, like I have one patient that comes to mind that she started craving Brussels sprouts. I mean,
they're so good.
And I mean, like she would eat a bag of them like per day. And so I feel like your body, once you cut a lot of that stuff that is disrupting your appetite hormones and your blood sugar stabilizes, then it's like real food does start tasting
And it's amazing
better.
the grown adults that are still rebelling with food from childhood. I mean, I think you're being a kid. You're rebelling like a child. They don't want to eat their vegetables. I'm like, you are going to eat it, and you're going to try it, and you're going to do it this way, and you're going to like it. And they come back and, wow, I really did like that. I'm like, it's because you haven't tried it in 15 years. Or your mom might have just gave you unseasoned steamed broccoli with nothing on. Anyway, I just try to tell people keep an open mind. Try to make it fun. I'm like, it's a choice. I don't necessarily, I cook. Well, I do my best to put food together in the evening. There's a lot of other things I'd love to do with my time. I'd love to put my feet up and watch Netflix and not do any of that. But you have to make it a priority. You have to make it a choice. I tell patients, make it fun. Find a way to make it fun, whatever that is. I don't know, try a new recipe, play music while you're cooking. Make your kids do half of it. I make my kids do a lot of it. That's great. And then you're teaching them, what to do. My 8-year-old can peel potatoes and carrots and cut up stuff and do all that stuff. Anyway, diet's very important. I only said 2, but that's a lot of things.
Yeah, no, that's a lot of
Exercise,
things.
huge. Exercise. Move. And, people say, oh, I go up and down the stairs. Okay, that's good. But be aware of what you're doing. So while I have a love-hate relationship with my watch, and maybe it's letting off EMFs or whatever, I don't know, but get something so you're aware of what you're doing every day. Know how much you're walking every day. Some people are misinformed. They think they're doing more than they are. But movement is so important. You got to be moving your muscles. And typically for the menstruating woman, I like to tell them, do more of your intense exercise in the beginning of the cycle and your weight workouts. And then the second half, do more of your slow, like running or like not running, or slow jogging or long walks and things like that, second half of the cycle, when progesterone's higher. Really, really helpful. But some sort of movement in the beginning is so important. You got to be moving. And if you have problems or hip or knee or issues, of course, you want to work around those things, but that's huge.
Yeah.
Sweating is important too. Yeah. I love to sweat.
Detox.
Believe it or not.
Yeah. All right. Well, thank you so much.
Is it already over?
Yes, we're over time. But I'm sure Dr. Jen will stick around if anybody has any quick questions afterwards. But thank you so much for coming. There is a survey in your packet. If you could fill that out, and especially at the bottom, write any ideas for future lectures that you want to hear. And we will go ahead and we'll collect any of those that are filled out, and we have a drawing for a lovely gift basket up here, so stick around for that. But thank you all so much for coming today. We're so excited you braved the cold weather to be here with us. And next month, the end of February, I'm kind of continuing our women's health series. Connie Paraska will be talking about mindfulness. So if this stress conversation really resonated with you and you're looking for some easy ways to kind of tone down your stress levels, then that will be an excellent lecture that you'll have some great takeaways